Once again, as I have already discussed about the Parkinson's disease, the mystery, the search, and the promise is still left. Okay, so let's see what is the main drug given in Parkinson's disease, and किस तरीके से इसकी mystery solve हो सकती है. Yeah, this one. Okay, so this is the main drug. You call it as levodopa. It is given actually in this thing, Parkinson's disease, and name hai levodopa. So a person suffering from Parkinson's disease, this is the main very important drug, levodopa hai, which is given in Parkinson patient. Or let's see what is the mystery behind levodopa. Okay, levodopa. It has a salutary effect in Parkinson's disease, and its efficacy exceeding than any other drug used alone, and it's inactive by itself, but is the immediate precursor of the transmitter dopamine. Levodopa. Acha, levodopa. It has the specific salutary effect in Parkinson's disease. Okay, so if a patient is suffering from Parkinson's disease, so just give him this. Okay, ये वाला drug, ठीक है ना? Or it is very strong. Okay, very strong drug, or it's efficacy exceeding than any other drug, and it is inactive by itself, and it's the immediate precursor of the transmitter dopamine. Okay, so levodopa. Actions. Okay, what are the actions of levodopa on central nervous system? It produces any effect in normal individuals, and symptomatic improvement occurs in Parkinsonian patients. Hypokinesia, rigidity resolve first, later tremor, and secondary symptoms of posture, gait, handwriting, speech, facial expressions, mood, self-care, interest in life are gradually normalized. Okay, so CNS in patients suffering from CNS, जो symptomatic improvement like hypokinesia, rigidity, they resolve first, and later tremor, and secondary symptoms of posture, gait, handwriting, speech, facial expressions, self-care, interest in life are normalized. So any person suffering from Parkinson's disease, levodopa jiske, who shows such kind of symptoms, though there will be personality improvement. Okay, and next on cardiovascular system, what will be the effect? There will be tachycardia by acting on beta adrenergic receptors, and postural hypotension, okay, is due to central and ganglionic actions, is quite common. Okay, next on endocrine, it acts on pituitary mammotropes to inhibit prolactin release, blood prolactin levels falls. Okay, so CNS में what will personality improvement, and on cardiovascular system, tachycardia it can cause by acting on beta adrenergic receptors, and postural hypertension. Or endocrine में dopamine acts on pituitary mammotropes, and it inhibits prolactin release, blood prolactin level falls. So this is the effect of levodopa on CNS, and CVS, CVS, and on endocrine. So actions are very strong. Okay, and very curable. Now any drug in pharma, if you prescribe to patient, okay, so थोड़े बहुत तो साइड इफ़ेक्ट्स एडवर्स इफ़ेक्ट्स तो होते ही हैं. ओके, सो पहला जो एडवर्स इफ़ेक्ट है, यू हैव द नोज़िया, वॉमिटिंग. ओके, एंड देन tolerance develops and the dose can be progressively increased. And then you have the postural hypotension. It occurs in one third of the patients but is symptomatic. Some patients experience dizziness. Okay, a few have fainting attacks. Tolerance develops with continued treatment. So जो एडवर्स इफेक्ट्स होते हैं, तो पहला है nausea, vomiting. Tolerance develops and then dose can be progressively increased. Postural hypotension. It occurs in one third of the patients but symptomatic. And patients experience dizziness, they have fainting attacks. Tolerance develops with continued treatment. Okay, so these are the adverse effects. Okay, so nausea, vomiting, tolerance will be developed, and postural hypotension. Postural hypotension, you have dizziness, fainting attacks, or tolerance. Fine. So ये adverse effect है levodopa के. So before prescribing any drug, the dose should be correct. Okay, बहुत कम, too less, too more, if the dose is there. So adverse effects, so you should be careful. The doctors, everybody should be careful. Okay. दूसरे adverse effects हैं, you have the cardiac arrhythmias, exacerbation of angina, alteration in taste sensation, abnormal movements. Okay, you have facial tics, grimacing, tongue thrusting, choreothetoid movements of limbs start appearing few months of use of levodopa. Behavioral effects like anxiety, nightmares, depression, mania, hallucination, mental confusion, frank psychosis, fluctuation in motor performance. 2 to 5 years of therapy, the level control of Parkinsonism symptomatology starts showing. Okay, so you have the cardiac arrhythmias, exacerbation of angina, alteration in taste sensation, abnormal movements. You have the facial tics, you have the grimacing, tongue thrusting, choreothetoid movements of limbs start appearing. So जो adverse effects हैं, so cardiac arrhythmias or exacerbation of angina, taste sensation, ये सब problems, these problems can be shown, and abnormal movements, movements पे abnormality, you can be shown in facial tics, grimacing, tongue thrusting, choreothetoid movements, behavior changes. Okay, so behavior you have, it will range from mild anxiety, nightmares, to depression, mania, hallucinations, mental confusions, frank psychosis, anxiety, nightmares, depression, mania, hallucination, fluctuation in motor performance. After 2 to 5 years of therapy, the level of control of Parkinsonism symptomatology starts showing. So you have fluctuation in motor performance. 2 to 5 years of therapy, the level control of Parkinsonism symptomatology improves. So motor performance, these are the adverse effects. Take care on behavior. There will be abnormal movements, and there will be fluctuation in motor performance. Okay, so this was all about levodopa, and I hope you have understood what I wanted to explain about the levodopa. And if you like my topic, so please just like, comment, subscribe to my channel, and thank you so much for your attention and viewing.